Welcome to Raise the Line with Osmosis.org, seeking solutions with leading experts on how to increase healthcare capacity so people can get the care they need during the COVID-19 crisis and beyond.
Hi, I'm Dr. Rishi Desai. We've spoken to many frontline providers on Raise the Line to get a ground-level perspective on the pandemic. But today, we want to step back a bit and get an administrator's view on the crisis. Here to tell us how COVID is impacting hospital operations and what the future holds for health systems in a post-COVID world is Varun Khanna, Director at Siloam Hospitals Group, which is the largest private hospital network in Indonesia. He brings many years of experience in business and healthcare management to that role. In his past roles, he's been the Executive Vice President at Fortis Healthcare and also the Managing Director at Becton Dickinson for India and South Asia, one of the largest medical technology companies in the world. Thank you so much for being with us today.
Oh, thank you, Rishi. A pleasure to be on the show with you.
So maybe we can just back up and you can tell me a little bit about kind of what got you interested in healthcare management. What was your first professional dip into that sector?
So that's a very interesting question, Rishi. I've been doing healthcare for about 12, 13 years now. And I never trained for healthcare from an education perspective. I graduated in computer science and did my master's in marketing and finance and then started working for a telecom company, followed by a retail company. Now, I've been lucky in a way that I've pivoted a few careers, which has given me a lot of diversity of experiences. But at some stage in career, you start thinking, what is it that you want to do, which kind of kindles your passion, which helps you follow a purpose and still make you some money, right? Not the other way around. There was a time when this happened to me as well. And I was at that time running fairly large operations in telecom. And I thought to myself that there are two careers that I'd love to do. One is healthcare and education. And as luck would have it, healthcare happened first. So in India, healthcare largely, till about a decade and a half back, was run by doctors, right? Even the administrative side. The P&Ls of hospitals didn't look good. The receivables were crazy. Customer management was limited to clinical side of it, but the service aspect of it was probably not there. And let alone using data, let alone using digital technology. And when you're not wired for this, you don't think about it, right? And I think which is where the match was. A gentleman by the name of Shivinder Singh, who then owned Fortis, was looking at someone who can look beyond the clinical aspects of healthcare and also kind of manage the P&L and allow the company to grow, because unless you have a sustainable P&L, you're not able to grow. So I think it was kind of a good match, and it just happened. Now, as you know, the healthcare space is unlike any of the other businesses. And I always saying that it's one of the most complex businesses that you could run. So it needs a lot of training. It has a huge entry barrier, right? And for that entry barrier, when I joined Fortis Healthcare, I actually went through significant training for about a year. Which covered all aspects of healthcare, not limited to clinical, but administrative. And I came to the US as well to study. And so it was a huge induction program for about a year that kind of got me going.
So I'm curious, what was it like culturally? You said 10, 15 years ago, it was mostly clinicians kind of running P&Ls, and that's obviously not what they're trained in doing. And so probably making some mistakes, I would venture to guess. And you come along as someone that's not clinically trained, and you have a very different sort of skill set. What was that initial maybe year to 3 year window when you first got injected into the program?
It's difficult to be, in those days, certainly, it was very difficult to get into a organization which is run by clinicians, and I was pretty young as well, looked young for whatever it's worth, right? So yes, it was a difficult task. So the company got split into three parts, right? So the company had acquired an asset in the western and the eastern part of India. So what the management did then was they actually placed a doctor in the north and gave me the new acquisition to integrate into the company, which was the western and the eastern side of it. It was a completely separate network, and I was kind of held responsible for that part. It took a little while to kind of make space with the clinicians, but the fact of the matter is that relationships do work in India. And once the doctors start believing that you're there to help them and not in any way take anything away, then it becomes healthy business. So it did take 12 to 18 months, but I think the relationship orientation that I had led me through.
So it kind of segues into my next question, which is about managing change in healthcare organizations. I mean, you've been doing this for a good chunk of your career. What are some lessons you've picked up along the way in terms of what are some ways to do it right? And also what are some ways to kind of avoid so you don't make missteps in managing change?
I think there are three aspects to this which I want to touch upon. The first one is healthcare is about a lot of people. It's not just systems and infrastructure. So I call healthcare as TTI, talent, technology, and infrastructure. And if you come to think of it, talent is huge, right? You have clinicians, you have nurses, you have administrators, and you have a whole lot of associates. So it's not something that is run by machines; it's run by humans. So the first and the most important aspect is the talent management, and I think most critical. The second one that I've realized is over the last, again, 14 years, is that you got to continue to grow. Your clinical talent is with you, your administrative talent is with you if you're growing. The moment you start getting static in this business, you'll have attrition, which is clinical attrition, and that gets you into spiral downward loop. Till you are able to think strategically as to what to add and how to enable growth for the clinicians, I think that's where the key is. And if you are able to show growth year on year, the fees that the doctors would take back or the incomes that the whole system will generate will keep on growing. And that is something that everybody loves. The third is communication has been the key to success. And communication is not talking about doctor administration communication. I'm talking about a 360 communication, right? One of the things that helped us succeed in the businesses that I've run has been communication to the consumer, has been communication with the doctors, doctor to consumer, doctor to patient. I think that's the third incredibly important aspect in our business. Now, you may say that all of this is important everywhere, but I think these are the three key ones that really kind of hold the key in this business.
I know a lot of our audience would love to learn a little bit more about Siloam Hospitals Group. Do you mind just giving us a sense of its scale, how it fits into the healthcare landscape in Indonesia?
Yeah, so Rishi, as you rightly mentioned, we are the largest private healthcare chain in the country, and not only largest by number of hospitals, but number of beds. So we run about 40 hospitals, we run about 40 clinics, cumulative almost 4,000 beds in the country. And the beauty of our network is that we are spread out across the country. So we cover 27 cities across Indonesia. We complete 25 years of existence this year. We deal with about a couple of million patients every year across our OPDs, IPDs, and EDs. We are a listed organization in the Indonesian stock exchange with a market cap in excess of $1 billion US. So that's the size and scale. We partner, associate with almost 9% of the clinicians in Indonesia. So that's the level of scale that we have in that country.
That's remarkable. And of course, then you'll have a good set of insights into the next question, which is what's happening on the ground in Indonesia right now with COVID, and how's the healthcare system right now managing that situation? How's it looking from your vantage point?
So it's a little depressing these days. With this wave of COVID, Indonesia has got impacted significantly. Capacities are running out. Oxygen's been an issue. Of course, infection rates have gone up. Death rates have gone up. Three key things again. One, the penetration of vaccination is still not very high. Double dose, which is the complete vaccination, I think is only single-digit percentages from a population standpoint. The single dose is now touching about 18, 19%, but there's a long way to go. Indonesia does have a constraint on healthcare infrastructure as well, and most importantly, testing. For a 260 to 70 million people, Indonesia's PCR capacity, 60 to 80,000 PCRs a day. And that, as you would imagine, is much lower than what WHO really prescribes. And therefore, when we look at 50, 55,000 positive numbers in Indonesia, it is constrained by the level of testing as well. Having said that, as we know that this disease comes in like a wave and the wave then perishes as well. We've seen the statistics in India on the Delta virus, and we've been tracking that closely as well because India preceded this curve in Indonesia. We have created a lot of predictor models for ourselves in Indonesia so that we are able to gear up our capacities and more importantly, our people, because sometimes the constraint is not the physical capacity. It turns out to be nurses. Because in this disease, what's happened that the more the nurses treat, there is an infection that they acquire as well, which does not allow them to really operate. And that's something that we've got impacted with. Indonesia has got impacted with. A lot of healthcare workers have got impacted, and therefore they're not able to then serve the patients to the fullest. So yeah, with all of those constraints, it's been a little bit of a tough time. In the last week or so, we've seen the numbers getting slightly better. So Indonesia was reporting anything between 50 to 60,000 cases a day. And that number in the last 1 week is averaging about 30, 35,000. So that goes on to say that the peak may be kind of right there, and then we'll start to see the numbers dwindling down.
Do you mind just sharing a little bit more about that? So obviously, when you walk into a hospital, the expectation is that you're going to have healthcare providers there. And in my mind, I often have said to myself, a hospital without nurses and doctors is basically just a very expensive hotel room because you don't have anyone to deliver the care that you need. And so what are some of the solutions that you're seeing to help with that incredible shortage that you just described, where some of the nurses are getting sick? Are there any sort of creative solutions that you've come across that are happening in some hospitals and maybe extending to other hospitals as time goes on and they learn from one another?
The problem persists. While we've figured out some solutions, the problem certainly persists. Lack of infrastructure cannot be replaced. What we've tried to do is develop protocols around home care. With COVID, what happens that there is panic. Anybody who turns positive rushes to a hospital, and this is what we see in Indonesia as well. So, the moment you turn positive and you know that oxygen is a constraint, bed is a constraint. So the first thing, and the influential people would do it a little bit more, they run towards the bed. And that is something I think that's caused a lot of panic, because then the patients who really need the bed, who really need the hospital care, don't get it, because people who probably could do without are occupying a bed. So that's one thing that we did. So we started to ensure that when the bed is given out, it's given out to patients who really need it. For the ones who are not so acute, we developed home care services. We were able to provide cover in the comfort of their home, and one nurse could actually manage about 10 patients a day, sometimes even 15. Because at the end of the day, those patients, once they get over their initial reaction to turning positive, they're fine. They just need the drugs, they just need some care. They just need to isolate themselves. And unless they get into breathing issues and so on and so forth, they'll recover over a period of 2 weeks. So that piece, I think, really helped us. So that's the second solution that we really created. The third was we digitized almost everything. So we were in the process of digitization of our services. I think COVID catalyzed the whole process, right? And that brought in a lot of system. So people won't run to a hospital unless they've got their bookings done and appointments done and scheduling is organized. So, there won't be a point in time where there are queues and queues of people standing outside. I'm not saying it doesn't happen. A lot of people still don't use or don't want to use the digital services, but that has impacted the scenario on the ground very positively.
I'm curious, right now we have in the US almost a story of two countries, those that are unvaccinated and those that are vaccinated. And there's a huge issue around vaccine hesitancy. I'm just curious to know, what is the on the ground situation in Indonesia? Is it simply what you said, just simply not enough vaccine for the population at the moment and sort of logistic issue? Or is there any sort of cultural issue around vaccination itself, like we see it here in the US?
Rishi, so, it's a difficult comparison between US and Indonesia. The resources are very different. The government spends are very different. And I would say that resource is a constraint there. And when I say it's not financial resources, I think it's availability and access to the vaccines. In Indonesia, we've seen that the vaccines really came in from China. A very small part of it was AstraZeneca. And it still did not have access to some of the large, so to say, Pfizer's and Moderna's of the world were not freely available. So it's a very spread out country. And that complicates matters significantly. It's also a sizable country. So while the rate has gone to about 1 million vaccines a day, it's not good enough, is the way I see it. Trying to answer your question on the cultural side of it, I don't think people are resisting vaccines there, like the US, where in spite of availability, the number is not now getting beyond the 57, 58% mark. But if vaccines keep on coming into Indonesia, Indonesia will continue to vaccinate, is the way I see it. I don't think cultural constraints will come in. Constraints are more to do with infrastructure, with manpower, and availability of vaccines.
Yeah, that's very interesting. And thank you for kind of laying it side by side and pointing out some of the key differences. I'm curious, you said earlier that you were planning on digitizing anyway, and COVID kind of accelerated that process. Are there any other things or examples you can think of that were happening anyway, but got accelerated by COVID? And once the acute crisis of COVID is over, do you see anything that probably won't go back to the way things used to be, because now things have just changed in terms of how healthcare is delivered?
Rishi, I have a view here which I'd love to table. When the disease came in, we all thought, at least personally, I did think that it's kind of a disruption that'll go away in 2-3 months. It's a disease that's temporary, right? The world has seen it in the past, but it kind of gets over, right? I think over the last 1.5 years, that's changing. I don't believe COVID is a disruption anymore. It's going to be a paradigm shift in our lives. I certainly don't know currently how will we get over it. I mean, I don't see a scientific way of saying that one fine day COVID will vanish. We don't have the vaccines which can guarantee us that we'll not get infected currently. There's no treatment for the disease which is validated to the extent that you can say, okay, go with this disease and it will just be a common cold and nothing else. The death rates are continuing to be high in many countries still. Some have started believing that infectious diseases, whether it's COVID, one mutation, second mutation, you call it Delta or Alpha, some of this is going to stay. We'll have to learn to manage lives alongside some of these infectious diseases. So a lot of people have started talking about this, and we have to start thinking of how to manage our businesses with COVID, really. And the other thing that's happening is so many people have got impacted. Our lifestyles have changed. There's a different kind of a disease which is emerging. Let me give you a sense of some of the things that we've been talking about. We've actually started thinking of future trends and what the world should be prepared for. Look at things like behavioral health. There's so much changing. You and I, instead of meeting and being in a studio and recording this, are on a Zoom call, and we are looking into the screens. And I can tell you that within our organization, we've seen a lot of people whose eyes have got impacted. So they have begun some sort of treatment. Now, what are the long-term impacts of this? We'll wait and watch, right? But there certainly will be an impact. We are seeing in Indonesia more cases of excessive smoking now, because people are at home and they believe that working from home is not that taxing, and therefore there's more time, and there's more time they're either consuming meals or alcohol or cigarettes. And there is a degree of unhealthy lifestyle that is coming in. Now, all of this will lead to a change in our health levels. I'll tell you a significant trend. 2 years back, a significant component of our revenue used to come through medical checkups. No one turns up to a hospital for a medical checkup anymore, right? Unless we provide diagnostics at home, there is no medical checkup business. If you go to a medical checkup, we've got plush medical checkup rooms and there's no one turning up. Corporate medical checkups are not happening anymore. So a significant revenue streams got impacted, right? Is there a market for it? Certainly. People still want to get the diagnostics done as long as we can reach out to them, as opposed to they coming into us. So I think that's another significant change and seeing on diagnostics. Now, on diagnostics, previously, if you had fever or cold, you won't go running to a hospital. Today, you sneeze and you go running to a hospital. So therefore, the need for diagnostics will go up. If you look at all diagnostics companies across the globe, throughput has increased. Now, whether it's a COVID testing, and I'm sure there'll be more on the COVID testing side that will keep coming in. There is an after effect of COVID as well, right? Some people have seen cardiac issues, some people have seen neuro issues. So I'm saying that COVID is not that short-term assignment. It's going to be longer COVID. And while the Western world is planning for it, there are clinics emerging on treatment of post-COVID patients, right? Or well-being of post-COVID patients. I think that's another significant trend that we need to be mindful of. I think the last part of it is site of service, right? There was a time that we were looking at hospitals, larger hospitals, right? So that economics could be managed. But I think now we'll have to start thinking of care delivery on site, right? Today, our corporates want us to be there in their offices, in their factories. People want us to operate from home. People are looking at digital services. Teleconsult has really gone up. I mean, you look at tele and chat consults, that's becoming the order of the day. So doctors have to learn to deliver care through a call center. I mean, something that they never want to do, never, right? If you ask the specialist, would you be okay sitting at a call center? The answer would be a no, right? 2 years back. And I think all of this will lead to a lot of change. There will be technology coming in, which will be disrupting the way services have been delivered in the past. And the world has started thinking on those lines. I think COVID's really going to change a lot in healthcare delivery systems as well.
Wow, that is, oftentimes they use the phrase "food for thought." That was a 7-course meal for thought, because I think every one of those points you can expand upon and play it out. And clearly, as you rightly pointed, we're not ever really going to go back, and so many things have to be rethought through, and it on a timeline that really no one expected 18 months ago. So that makes a lot of sense.
If I may, Rishi, just add, you don't have multinationals operating hospitals across the world, right? And come to think of it, that's the only space where multinationals aren't there. I think now when remote care starts to get acceptance, I mean, you could be sitting in the US and treating a patient somewhere in Asia or other way around. I think it's still early days, but I would imagine because of COVID, a lot of that will also change. Healthcare delivery will not know regional boundaries anymore, and care will transcend beyond boundaries, beyond countries. And I think that's another significant disruption that the globe will see.
Yeah, that's a really interesting point. I have never really given that thought, the fact that multinationals don't really exist in this vertical, which is a vertical that is so steeped in money. I mean, up and down. So it's kind of surprising. And I think you're right that this is a time when we might start seeing that quite soon. Listen, you've given me a lot to think about. I know our audience is probably just tantalized by what you just said. That was fantastic. And our hearts, of course, go out to the folks that are dealing with COVID, not just in Indonesia, but really around the world. So thank you for joining the show and talking us through all of that.
Excellent, Rishi. A pleasure to be on the show. Thank you so much. And I hope that your listeners are able to benefit from what I've said. And I can certainly receive any queries if they have on my email, and I'll be happy to respond.
Yeah, thank you for that. Very generous of you. Listen, I'm Rishi Desai. Thank you for checking out today's show. Remember to do your part to flatten the curve and raise the line. We're all in this together.
For more information on how you can help raise the line and flatten the curve, go to osmosis.org/COVID-19. If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our podcasts at osmosis.org/raisethelinepodcast.